So we are back inside the 3-Point Conversion Sports Lounge, bobbing our heads to the beat. And we have Dr. Donnie Fowler the third, orthopedic for OrthoAtlanta. How you doing today, good sir?
What's up, guys? Doing well. How are you?
We all right. We all right. You
Good.
over there? You know Duke got put out. You over there? You okay over there?
Yeah, it's gonna be a little depressing watching the Final Four today. I'm not gonna lie, but they were all great games. I mean, I think that was the best. I was telling Raphael, I think that was the best Elite Eight, like all 4 games combined that I can remember seeing in a while. So,
All right, that's cool, man. I'm glad you're good, man.
yeah.
Because I like I said, I'm a Bears fan. You know how I am. So like I kind of want to bring it up, but
No. I mean, honestly, I'll make it. For me, Duke's going to be back at some point. That's not what I get most sad or disappointed about. What I actually get the most sad about is not watching Zion get to play another college game. Because it'll be fun to watch him in the NBA, but it's obviously not the same as kind of seeing what he does in college. So.
And you think he'll be crazy and out of his mind to come back, right?
I think he will. I mean, he hasn't announced yet, as far as I know, but I can't see him coming back with what's out there waiting for him. So
he probably looking like y'all didn't. I mean, that should be a foregone conclusion.
He said it that night. They were like, "Are you coming?" They asked him some question about it. He was like, "This is more than likely my last game."
Right. So, but shout out to Duke. Now, baseball. Clayton Kershaw, this man is he was out and there was a shoulder, right? And
shoulder.
Yeah, and he came back for his first game, first rehab game, and had his first start in AAA, and he gave up 2 runs and 4 hits. Little rusty, okay. But how long will it take him to get back, like with an injury like that, especially pitching is what he's using, It's not like it's an ankle, but I'm saying like he's throwing. How long does it take for a player of his caliber to come back and be at that level that he once was?
Yeah, I think granted Kershaw's been around for a while. He knows what he's doing, but anyone trying to get back in the swing of things, I would say it's going to take at least 3 or 4 starts at the major league level before he's really probably going to be somewhat in his groove, of course, assuming there are no setbacks. So, I mean, probably talking at least another month or so. They were talking about doing at least one more rehab start in AAA before he joins the team, coming off the, I guess I can't say the DL anymore, but the IL or IR, whatever they say now.
What is it? Is it IL now?
It's the injured list.
Yeah. IG.
Yeah.
Oh yeah, you can't call it disabled list.
Yeah.
Right? It's the IL injured list.
Yeah. So I think it's going to bear watching. I mean, obviously, no one wants to see him get hurt. Of course, when you're already started off the season, like we talked about a month ago, and having shoulder issues just throwing, you worry a little bit. I think they said his velocity was mainly high 80s on his fastball, touched 90 once or twice. So that's a little lower than kind of where he's typically at. So I think that's something to kind of keep an eye on, too, if he can kind of get his velocity back up as well. So.
Okay, now we know baseball pitchers can get a blister, and they'll be out, 2 to 3 weeks. Why is this right? 3 months from a blister. Why is this injury so impactful?
Yeah, I mean, it seems funny talking about blisters. I think a lot of it, obviously, I mean, when you think about it, how a pitcher has to grip the ball and throw, if they're having, it's not the blister itself, obviously, that is an issue. It's how they're going to compensate throwing the ball with having a blister, because it's going to be painful in certain positions, so they're going to re-grip it a little differently, probably slant their arm a little differently, and it can just kind of up the chain of the arm, create problems in the elbow or the shoulder if you just start messing a little bit with things. So I think that's kind of the big thing, even though it sounds silly talking about missing a couple weeks with a blister.
Yeah, I used to think like, man, I remember my father make me cut the grass or do something, and I had a blister. I had to keep doing it. I couldn't, whatever. I had to endure the pain, but it's just, hearing that when you're young, I just never, understood that. And it was like, man, why is he out this long with a blister? But I guess that makes sense. So it's no way to, so you can't, you can't put like a Band-Aid on it or anything like that, huh?
I mean, you can, but then you got something else that's on there that kind of affects how you're gripping the ball. Sometimes they'll even do like super glue or something like that, believe it or not, just to like put some kind of barrier over top of it so you're not really feeling the pain. So try that sometimes more so than like a Band-Aid. But like I said, it's all a matter of them being comfortable gripping the ball when they throw, so they're not changing anything up.
No, I definitely understand, and I think I saw a pitcher get a blister on his off-throwing hand. He still was out 3 weeks. But anyway, we wanted to discuss. We didn't. This is the perfect time to discuss it. So we talked about the Hawks and if they should win. They have a chance to basically secure the 5th spot with the 5th worst losing record in the league, which gives them a better chance to get Dallas, first round pick if they don't get within the top 5 picks. So going into the other teams, when it comes to the playoffs, you have a lot of teams talking about they're going to rest their players. Joel Embiid, he's sitting out. I know Kyrie once talked about, it's okay for me to sit out if we have 6-7 games left. We just make it, as long as we're in the playoffs. How do you feel about this? And is there a chance of increasing their chance of getting injured when they do this, sit 5-6 games and come back for the playoffs?
Yeah, I mean, I think it's a little bit of a double-edged sword. Obviously, NBA season's pretty long, going over 82 games. And so in a way, I think kind of being healthy trumps, I guess. I mean, being healthy trumps being like ready in the sense that you've been playing every game and feel like you're in the swing of things. If you keep playing every game, but you're fatigued, you got some lingering things, and you're not going to be at 100%, I don't know if I'd take that over maybe being rusty for the first game or two back in a playoff series by taking off a little bit at the end of the season just to make sure that you're ready to go. I think in most cases, the better teams, the top seeds, well, at least in the East, the West is obviously a lot more deep, but I don't think they worry as much in the first round as far as those bottom, 6, 7, and 8 seeds that they'll be playing. So they probably feel like they got a little bit of wiggle room with bringing guys back and phasing things back in. So,
absolutely. Now, I had a question about Chris Sale. I know recently his fastball is topping out in the low 90s, mostly hovering around the upper 80s, though. Do you think this still isn't something possibly with his shoulder, which was a late last season injury, or is there anything you can speak on with that?
Yeah, it's always tough. Velocity is a big thing in any pitcher that they look at year to year, especially coming off an injury or coming off surgery. So, I mean, I think the bigger thing is pain. As long as he's not really reporting pain, even if his velocity is down a little bit, sometimes that just takes a little bit more strengthening and conditioning and endurance as kind of the season goes on. So I guess I wouldn't necessarily panic, but if you start seeing the lower velocity and start hearing about pain or discomfort, I think that's a big red flag. So,
all right, there you have it, Dr. Donnie Fowler III from OrthoAtlanta, the orthopedic. We appreciate you for coming on, sir. You have a great rest of your day and be safe.
All right, guys, have a great weekend.
All right, thank you. We're going to take a quick break, and we will be right back. Don't touch that dial or that Facebook.
Have a sports injury? Need to see an orthopedic doctor? OrthoAtlanta is one of Metro Atlanta's largest orthopedic and sports medicine practices, providing orthopedic and sports medicine care for the whole family. With 37 physicians and 14 offices, the practice provides the highest level of care for injury of muscles, joints, bones, and spine. OrthoAtlanta offers convenient access to a full range of musculoskeletal surgeons and specialists. OrthoAtlanta also offers on-site physical therapy, pain management care, MRI imaging, and workers' compensation care. The OrthoAtlanta surgery centers in Austell and Fayetteville provide cost-effective, same-day surgical procedures in an accredited outpatient center. Hip, knee, shoulder, back pain? OrthoAtlanta has you covered with specialists in all areas. Same-day appointments, orthopedic care for the whole family. OrthoAtlanta, Atlanta's choice for orthopedic and sports medicine care. Learn more at www.orthoatlanta.com.